Bismillahirrahmanirrahim. Assalamu alaikum to all of you doctors and medical students, and especially for postgraduate trainees. The main reason to make this video is to how we can assess some patient with to see his or her capacity. Either they are able to make some decision. For example, if you see a patient at ward who is 50 years old and you are planning to do endoscopy. So in such circumstances, how you will come to know that the patient has a good decision making capacity or not. So as I have told you earlier in my sessions, that you have to make a very good rapport with the patient, connect well with the patient, right? Give a very confident introduction of yourself, and then ask about the patient that what kind of information we have given to you, right? What do you know about endoscopy? What do you think that are the risks associated with the endoscopy procedure, and what are the benefits of undergoing endoscopy procedure, right? So just remember 4 areas: understanding, right? And is the patient able to weight that understanding? Is the patient understand to retain that information? Is the patient understand to communicate his understanding with the team, right? So in the first step I have told you about the understanding. In the second step we are going to do how can he retain the information what we have provided, right? So you can ask him why the doctors want to do endoscopy procedure, right? And when they have told you for the endoscopy procedure, so what were your views at that time when they have told you for the endoscopy procedure? In the next step, you can ask the patient how much weight, how much mental ability he has to weight that information. You can ask the patient that based on the doctor's suggestion, what do you think that either you should go under endoscopy or not? What is your decision? Either he is refusing or he is understanding, and he knows that the procedure is in his best interest, and this is to cure some kind of illness, some peptic ulcer, some kind of other gastric related procedure, right? So if the patient can understand information, if he or she can retain information, and based on his understanding, if he can make decision, right? So this means that he can weight that weight, WEIGHT, right? So he can weight that information based on his understanding. He can make the decision, right? And the fourth area is either he is able to communicate efficiently that information to the team or not, right? So you can ask the patient that for informed consent, so either verbally or in written form. So in my next videos I would be discussing about informed consent, but you can ask your patient that how will you be giving your consent, in written form or via implicit consent by agreeing to the plan. But always procedures like endoscopy, surgical procedures and other invasive procedures always require some kind of consent which is in the written form. So I thought for you guys to better understand how we can understand someone's capacity to make decision for some procedure, so in that context I thought to make this video. Thank you so much, ladies and gentlemen, for your time. See you again. Allah Hafiz.